Hello and welcome to a brief synopsis of the back, arm, and rotator cuff area, dorsal scapular region. We're also going to cover the feed as well as the brachial plexus. So this might be valuable. We'll also do a separate video just on brachial plexus in case you are studying that as a sole entity. So if we zoom in for a second, you can see that we have the extrinsic muscles of the back. These are superficial muscles of the back. And the superficial extrinsic muscles of the back are innervated by ventral rami without exception. The trapezius, which is both an upward rotator as well as something that elevates the clavicle and scapula as well as retracts and lowers it, this structure is innervated by ventral rami. We just call it cranial nerve 11. We call it the fake cranial nerve because the spinal accessory nerve actually comes from C1 to C5 ventral rami. The Latissimus Dorsi is a large muscle on the back coming from T6 all the way down to the thoracolumbar aponeurosis and attaching to the intertubercular sulcus. This structure is a superficial muscle of the back. It does not move the back, so it's innervated by ventral rami. It's innervated by the thoracodorsal nerve. And think of this as the touchdown nerve, TD. Because when you spike a football in a touchdown, you go into big extension of the arms. And a touchdown is worth 6 points, or with a kick 7, and also with a 2-point conversion 8. So 6 to 8. Pretty cool way to remember it. Also, if you like songs, 6, 7, 8, make my lats look so great. That's a fun way to do it when you're doing rows in the gym to remind you what Latissimus Dorsi is innervated by. The rhomboideus group, rhomboid minor, rhomboid major, these structures come from C7 down to T4 and attach to the medial border of the scapula, just anterior to another muscle called serratus anterior. Serratus anterior is actually not part of the actual back. It's a scapulothoracic muscle, but that's innervated by long thoracic nerve if you want to memorize that as well. Rhomboid group is innervated by dorsal scapular nerve, C4, C5 ventral rami. Levator scapula is an elevator and a retractor of the scapula as well as a downward rotator. It is a superficial muscle of the back because it attaches to transverse processes C1 to C4 heading down to the superior angle of the scapula. It gets mostly C3, C4 and a twig from the dorsoscapular nerve. The serratus posterior muscles that are superior and inferior. One is superior deep to rhomboid, one is inferior deep to latissimus. These are the last of the muscles that are what's called epiaxial muscles innervated by ventral rami, and so they're innervated by segmental ventral rami without names. Now as you go into the intrinsic back muscles, these actually move the back. They don't have named rami for the most part. It's mostly dorsal rami, with the exception of splenius me getting a twig from the greater occipital nerve. The splenius group are the most superficial intrinsics. I know that seems like a misnomer, but they are the most external of the intrinsics. The intermediate intrinsics are erector spinae. These include iliocostalis, longissimus, and spinalis. I love my spine. The transversal spinalis group include things like semispinalis multifidus and rotatories, and they are the deep intrinsic muscles. We also have muscles called interspinalis, levator costarum, intertransversarii, very tiny muscles, also deep intrinsics, and all these muscles are innervated by segmental dorsal rami. The same rami that basically innervate the skin superficial to the respective musculature. As we come into the arm, the anterior arm is innervated by musculocutaneous nerve, ventral rami C5 to C7, and it's coracobrachialis, biceps brachii, and brachialis. These are anterior compartment muscles, and they mostly do flexion. And so just remember to flex your bicep, C5, C6, and 7, make my biceps look like heaven. So that can help you to remember it. The posterior compartment is the triceps brachii, the long lateral and medial head. These are innervated by radial nerve off the brachial plexus, and it's mostly C6 to T1, but your text may include also C5, so I included both of those there. The dorsal scapular muscles, which include the rotator cuff, I've starred the actual rotator cuff muscles, so you can see they sit on your shoulder, and they do humeral centration relative to the glenoid fossa to prevent dislocation. Other two muscles included in this dorsal scapular group would be Teres Major and deltoid, which are not rotator cuff muscles, but are innervated by the similar things as rotator cuff muscles, so are worth talking about. Their innervation is suprascapular nerve for the supraspinatus and infraspinatus. And note C5, C6 ventral rami are the spinal levels. Teres minor is axillary nerve, C5 to C6. Deltoid will also be axillary nerve, although Teres Minor is a rotator cuff muscle. Subscapularis is the last of the rotator cuff muscles, innervated by both upper and lower subscapular nerves, both C5 and C6. And Teres Major shares an innervation with the lower part of subscapularis with that lower subscapular nerve. Note that all of these are C5 and C6 because by rule, if you're a rotator cuff muscle, you have to be innervated by C5 and C6. So they're largely affected by a C4, C5 disc herniation in the neck. So make sure to protect your neck in order to protect your humeral centration. Now, for arterial supply, we have the subclavian artery giving you the VITCD branches, vitamin C and D. That is vertebral, internal thoracic, thyrocervical, as well as costocervical and dorsoscapular if it's present. And then the axillary artery is doing the majority of feed in this region here that we were talking about with the rotator cuff. The superior intercostal, thoracochromial trunk, lateral thoracic artery, and then the anterior and posterior humeral circumflex, subscapular arteries. The way to remember this is that there are 3 parts of the axillary artery, and there's 1 off the first part, 2 off the second part, 3 off the third part as main trunks. And then they're divided by the pec minor muscle, which you see dotted here and here. So if you're superior to the pec minor muscle, you are the first part. If you're deep to pec minor, you're off the second part. If you're inferior to pec minor, you're off the third part. The mnemonic is some teachers lie, some students try and pass. And so you can help yourself remember that by just continuing the mnemonic over and over. Just like subclavian had VITCD, vitamin C and D, axillary has some teachers lie, some students try and pass. The third part, distal to Teres Major, this artery changes its name again, and now it's the brachial artery. It gives off the deep brachial artery that you see here, some superior and inferior collaterals, as well as some adjacent branches for perforating branches, and then radial and ulnar arteries bifurcate at the cubital fossa. Innervating the vast majority of the area we discussed is the brachial plexus. And again, I will do a separate video on the brachial plexus. We have ready to drink cold beverages, right? Or Randy Travis drinks cold beers. Rob Thomas drinks cold beers. Whatever you like to help you with the mnemonic of roots as the most proximal parts of the brachial plexus and terminal branches as the most distal parts. It comes from mostly C5 to T1. Occasionally you'll get some twigs from C4 as well as T2, but for the most part, remember C5 to T1. And so we have an upper trunk of the brachial plexus, middle trunk and lower trunk of the brachial plexus, and I gave solid lines at the divisions level for the anterior divisions, and then dotted lines for the posterior divisions. And I also numbered all of the regular branches off, but then the terminal branches we listed as big names. Those include musculocutaneous, median, axillary, ulnar, and radial. And I also listed out the respective branches here off the brachial plexus. What I'll do is put a screenshot of this picture underneath the comments from my Instagram. Hopefully you'll find that to be very useful as you study, and I will do a separate video explaining the brachial plexus to you so that you can have that for your studies. Hopefully you found this video useful, and we'll see you next time.